screw, embossy, cogged or coned. Plain or micro threads, whether PDO or PLLA, in general, they are micro threads. They are very soft. They are of very soft, low diameter, 60 or 80. They're inserted into a micro needle. They come in the lengths of 12 to 60 millimeter. They are to be inserted into medium to deep dermis to create a mesh, basically. They are not for lifting purposes. They have non-invasive. They are used for non-invasive dermocosmetic treatment of biostimulation, but they need repetition at 4 to 8 months. Then you can see screw, spiral, or tornado threads. They are essentially the same screw micro threads, but they are inserted and rolled up in a micro cannula in a screw or spiral shape. They are to be inserted in dermis and subdermis with the same purpose, but they will create more biostimulation and retraction along the traction vectors. They have greater macrophagic response and more effective biostimulation is there. And as a result, there is more cascade effect on healing and tissue restructuring. Then there are embossy threads. They have grooves on them, as you can see in this picture. They are inserted again in microneedle. Length vary करती है 25 to 60 millimeters तक. They are inserted in mid to deep subdermis to create traction lines. And they have got permanent impression on them as a designing or mechanically they are produced through pressure. This grooving or embossing also creates more in macrophagic reaction that is useful for biostimulation without tissue fibrosis. Then we come toward cogs or barbs. What are the cogs, which are now very much in use, very much in fashion? They are again they are basically monofilament. They are inserted in deep subdermis to superficial mass. They can be inserted much deeper. They create suspension lines along the traction vectors. They are self-retaining. Cogs, essentially, as I told, they are monothreads that have barbs on them to hook the undersurface to the skin. Collagen formation occurs around them, and they form support structure. They don't need anchoring point. They get anchored through their own barbs. They are more effective for jawline lifting and slimming. Types of cogs, as you can see here, the pointer doesn't work here. You can see they may be unidirectional, they may be bidirectional in both directions, they may be multidirectional. Moreover, their directions may be convergent or that may be divergent. How the cogs are produced? What is the way of making barbs on them? They may be cutting or molding. You can appreciate the difference. And you must focus on the first line and the fourth line. Cutting threads type 1 and molding threads. Difference between them, focus on tensile strength. How much is it with the molding thread? And the anchoring strength, duration, how much does it last in the tissue? And tissue trauma, how does it cost? But the cost of procedure is again much more with the molding type of threads. Discussing the disadvantages of cutting type of threads. You can see it has been created by cuts through the thread. So it has got weak points in it. It can get disinserted due to pulling forces. It can get backward pulling, folding, and similarly breakage can occur. You can appreciate the difference between cutting and molding type of threads in this picture quite easily. Next came the idea of the cones, which work on drift anchor principle. It was based on the parachute idea. It was revolutionary in the concept of lifting threads. And with it, you can hold strong volumes by these cones. I'll explain it further afterwards. Let's revise it, just pictorial repetition for your review. You can appreciate the difference between cogs, mono screw, and tornado screw. Tornado is basically spiraled, two threads spiraled on their own. Another picture to show you difference, you can see tornado and screw threads and cog threads. So how to choose between all these types of threads? This was a magnificent, huge classification. So how to choose them? It depends on you. It depends on patient, what is the indication, what is our aim to treat, and what is the preference of the operator with what he or she is comfortable. What is the material of threads? You must know what results will it give, and the capacity of each one of them to attain these findings. Available to sab hain. You can get all these types of threads in market, but what to do, how to do, and till when? It all depends on operator and his or her knowledge. So to summarize it, When you want lifting or suspension, you need barbed, cogged, or cones thread at least. You can't do it with mono or tornado or screw threads. But when you just need biostimulation or a support network or just for rejuvenation, for prevention of aging purposes, you can use mono or spiral and you don't need the other category of threads. Conventionally speaking, ओल्ड क्लासिफिकेशन में कहा जाता था फाइब्रोजिंग थ्रेड्स और सस्पेंडिंग थ्रेड्स का डिफरेंस, जो कि अब थोड़ा सा मॉडिफाई हो चुका है, लेकिन कन्वेंशनली इस तरह कहा जाता था कि गोल्ड थ्रेड्स जो थे वो फाइब्रोजिंग के तौर पे यूज़ होते थे, अब कतन यूज़ नहीं किए जाते. नेट और क्रिस क्रॉसिंग टेक्निक में इसीलिए यूज़ किए जाते थे कि सुवेयर फाइब्रोसिस कराते थे. और सस्पेंडिंग थ्रेड्स कर्ल लिफ्ट के जरिए यूज़ किए जाते थे. कर्ल लिफ्ट को मैंने मेंशन नहीं किया, बिल्कुल यूज़ नहीं की जाती, अब सिर्फ हिस्टोरिकली आपको मिलेगी और टोटल कट थ्रू कर सकती है, इसलिए अब नहीं यूज़ की जाती. डिफरेंस जो समझना है, पीडीओ और पीएलएलए का डिफरेंस समझना इंपॉर्टेंट है. दिस इज़ द बेसिक ऑफ माई प्रेजेंटेशन, सो प्लीज़ ट्राई टू फोकस फॉर सम टाइम ऑन दिस स्लाइड. Keep it in mind what is the difference between PDO and PLLA. PDO, just take home points are these. It is partially degrading at 2 weeks and fully degraded, it will get fully degraded by 6 months. Its safety is not proven and dye in it is used, dye is used in it, so it can cause pigmentation on the skin. While PLLA, you can see it gets partially degraded at 6 months, it fully transformed to collagen in 12 to 24 months. It has got longer lasting results. It is naturally found in body, so not harmful. It is also US FDA approved as filler for AIDS atrophy. It is transparent, so this is added benefit, but it is costly, and also it has excellent safety record after for last 30 years. Again, the same repetition, so that you might be able to memorize it or keep it in mind. The difference between PDO and PLLA and PCL threads, what is their total retention time and what is the total mass loss time. Just a quick review of two of the very famous well-known brands, Aptos and Silitsoft. Just a brief review to make you aware. Aptos basically bidirectional threads थे with no anchoring points. They were first cog threads to be developed and they were non-absorbable monofilament proline के, जो शुरू में हमने proline discuss की थी, ये basically Aptos उसका है. It has been used for surgical sutures for many years. Aptos thread lift, basically नाम ही एंटीटोसिस डिवाइस से आया था. Very efficient है सर्जिकल करेक्शन के लिए. Easy insertion है, लेकिन disadvantages क्या हैं? Long lasting नहीं है. Prone to migration and extrusion. वही जो प्रोलीन के side effects थे कि, और ये कि superficially अगर आप लगाएंगे तो pliability फील होता रहेगा, पता चलता रहेगा पेशेंट को. सॉलिड एंकरेज के लिए आपको कैलिबर बढ़ाना पड़ेगा और कैलिबर बढ़ा के प्लायबिलिटी भी का मसला भी उतना ही बढ़ जाएगा. Silitsoft जो थ्रेड्स हैं ये रीअब्जॉर्बेबल हैं. ये प्रोलीन के कंट्रास्ट में ये PLLA की कोन्स हैं. थ्रेड ओरिजिनली जो थी प्रोलीन का यूज़ किया जाता था, जो फर्स्ट डेवलप हुआ था ये आइडिया प्रोलीन के थ्रेड पे PLLA की कोन्स. अब जो है PDO के थ्रेड पे PLLA की कोन्स हैं. ड्रिफ्ट एंकर प्रिंसिपल पे काम करती हैं. इसके साथ आप दो काम इकट्ठे कर सकते हैं. इमीडिएट रीपोजिशनिंग, जो आप लिफ्टिंग चाह रहे हैं, और फिर उसके बाद जो आप थ्रेड एक दफ़ा इंसर्ट कर देंगे, उसके बाद कोन्स रीअब्जॉर्ब होती जाएंगी, ग्रेजुअल कोलेजन प्रोडक्शन करती जाएंगी और आपका सेकंड एम भी अचीव हो जाएगा. तो ये इतने सारे एडवांटेजेस हैं. इसके साथ 360 डिग्री एंकरेज है. एडिपोज टिश्यू कोन्स का ग्रेटर एरिया है. वो सेकेंड ट्रैक्शन प्रोलीन के साथ पॉसिबल थी, इन थ्रेड्स के साथ पॉसिबल नहीं है. It can be inserted deeply, no problem of migration or extrusion. It has got few risks of asymmetry or displacement, and its effect will last about 3 years or more than that even. But the disadvantages are, again, only the difficult insertion, expertise is much more required for it, and the cost. This is the structure of PLLA, which I'm skipping due to shortage of time. Thanks for your attention.
Thank you.